Well, I'm Alan Dale from Gale Force Winds, and I want to tell you, I'm having a wonderful time right here at the big raise for the Healthcare Foundation at this beautiful Jag Hotel, downtown St. John's, Newfoundland and Labrador, talking to some wonderful people who are all leaning into this, having a bit of fun, raising a bit of money along the way. Sir, why don't you introduce yourself? Tell us what you do.
Hi, sure. Liam Kelly. I'm the Provincial Director of Research and Innovation at Newfoundland Labrador Health Services.
Research, Innovation, Newfoundland and Labrador Health Services. Huge title. Mm-hmm. There's a lot to unpack there.
Yeah.
So Liam, why don't you talk to me exactly what your job looked like day to day?
Yeah, so day to day is looking at new solutions, looking at challenges in the healthcare system, working with internal staff, physicians, companies, local startup companies, big multinational companies, looking at solving challenges in healthcare day to day.
So frontline workers have a problem.
Yep.
Trickles up to you. You say, we need to get a solution here. It's your team that goes out there and finds that solution, tries to find that match, whether locally, nationally, or internationally.
Yeah, so my team would be involved working with frontline staff, trying to understand the challenges, and then working with also industry and other staff within the organization to find solutions. And then the research piece comes in, really trying to understand how that potential solution can, improve value for the organization, right? Looking at ways to enhance patient outcomes and drive cost efficiencies.
Liam, I can't help but think that this is a near perfect collaboration of government, industry, and academia all working together to solve challenges. Am I right there?
You're exactly right, yeah. So you've hit the nail on the head there, working with industry, government, academia. So a lot of the work that we do is give access to the healthcare system to industry, startup companies, focus on a problem, and then we use research as a mechanism to answer questions along the way, trying to adopt those technologies in the health system.
Innovation, technology in healthcare, so vitally important. It must be amazing to be in the middle of that orbit. In fact, in the middle of the orbit.
Yeah, no, it's a lot of fun to be involved in innovation. And what you see, not just in Newfoundland, across Canada and across the world, there's so much innovation happening now, looking at transforming healthcare systems from the way that we've been doing it 50, 60, 80 years ago. Lots of new technologies coming to the forefront, AI, robotics, and really focus on enhancing outcomes for patients. So being in the middle of that, working with companies, working with staff inside the health system, it's a lot of fun.
Liam, for a guy like you who's connecting all these dots, and you know that you need money to fuel a lot of this, how important are these events?
They're incredibly important. So without raising money to be able to fund projects like, our innovation team takes on many projects every year. The Healthcare Foundation, for example, is a big funder of innovation within Newfoundland Labrador Health Services. We also rely on government funding as well through our COA and the provincial government. But these types of events where you get an industry coming together, working on raising money to really advance healthcare for the health system. Without these types of events and fundraising, we wouldn't be able to do the work that we do.
And of course, Newfoundlanders are very generous people. Everybody is touched by healthcare, and so many people want to give back. And this event, they're giving back in a great fun way. What's it like at the tables?
It's a lot of fun at the table. Not much of a poker player, but some seasoned poker players at the table, having fun and coaching along the way.
Yeah. I can tell by the smile on your face you're having fun out there. I can also tell by the excitement in your eyes you love your job. We thank you for what you do for the healthcare in Newfoundland and Labrador. Appreciate you being in this conversation.
Awesome. Thanks so much.